Hi, micro folks. So this is the second little movie we're doing during Open Lab November 22nd, 2019 for Lab Exam 2. And a question came up regarding selective and differential media. So we thought we'd make this short movie on classifying the different media that we used. And then I'll make some little short movies going into maybe, excuse me, specific examples of when we would use the media, maybe clinical application. So to start off with, folks, our triptych soy auger TSA, you'll recall this is an all-purpose medium. It grows a wide range of both bacteria and fungi. Right, so in our airborne microbe experiment, we predicted we'd see the greatest variety of microbes growing on the TSAs. In contrast, the Sabarodes dextrose medium, you'll recall this is selective for fungi. So in our airborne microbe experiment, all those incredible colonies that we grew on our SAB plates, we predicted these were all fungi, so either yeasts and or molds. SAB is not differential, however. We can't distinguish between different types of fungi just based on how they appear on SAB. And then when it got a little bit more complicated, folks, was when we started getting into differential media. So a differential media we discussed that's also enrichment is blood auger. So you basically take an all-purpose media recipe, maybe like TSA, and then you add blood to it. And blood is chock full of preformed organic molecules. Very importantly, it has all the growth factors that fastidious microbes require. So growth factors include amino acids, nucleic acid, nitrogenous base precursors, and vitamins. So these are things our fastidious microbes can't make for themselves. And the reason in a diagnostic lab you'd always want to plate a clinical sample to blood auger is that many of the microbial pathogens that infect humans or animals, they have to infect them because they're fastidious. They can't make all the organic molecules themselves. So the host becomes a source of the molecules. So folks, then blood auger is enrichment, but it's also differential based on hemolysis, right? So the types of hemolysis we discussed were alpha hemolysis, and alpha hemolysis is a greenish discoloration of the auger. I'm not sure if it's going to show up on the movie, you guys, but here we have this greenish discoloration of the media. That's the alpha hemolysis. It's described as incomplete hemolysis. And I think what that means is the red blood cells lyse, but the contents aren't destroyed. And then you get this greenish discoloration. For our lab, we wanted to remember 2 gram-positive bacterial pathogens that cause alpha hemolysis, and they were Streptococcus mutans in the mouth that can use sugar, make a slime layer, and then stick to our teeth, forming that biofilm, the plaque, that can increase our risk for dental caries and periodontal disease. And then, do you guys remember the second gram-positive coccus? Yeah, Streptococcus pneumonia, right? And do you remember, folks, that Streptococcus pneumonia can often cause secondary bacterial pneumonia in people that have recovered from influenza infections? Good. And then the second type of hemolysis we discussed was beta hemolysis. And beta hemolysis is described as complete lysis. And again, what that means is not only are the red blood cells lysed, but the contents are destroyed. So in beta hemolysis, I'm not sure you can see it here, but the auger should be totally clear. And indeed, they say you could actually read through the zone of beta hemolysis if it's really good, complete hemolysis. And we were saying that we want to remember for the lab exam 3 beta hemolytic bacterial pathogens. They're all gram-positive cocci. So one that commonly lives in our nose, and we also recovered it, folks, from throat swabs. And it makes sense, perhaps this bacterium, Staphylococcus aureus, it loves to live in our nose. But then it makes sense that it could also travel through the nose and back down into the throat. So we were actually recovered Staph aureus from the throat swabs. It's beta hemolytic. Remember, it can be very aggressive, a very aggressive tissue invader. If we isolate it from, say, an abscess or infected surgical site, we're going to be worried that it could spread. And also, we'd want to do antibiotic sensitivity testing on it because it's often resistant to multiple antibiotics. what if, folks, you had maybe a patient that had a sore throat, and you look in the back of their throat and you see little white dots in the back, and you're suspecting, I think this could be who? Streptococcus pyogenes, the pus producer, right? Streptococcus pyogenes is often referred to as group A streptococci, and it too will cause beta hemolysis on blood auger. But folks, I'm so glad we're talking about this. So folks, let's say that you do a throat swab, you plate to blood, you get multiple beta hemolytic colonies the next day. You do a gram stain, you're like, okay, they're gram-positive cocci. So, like, in my mind, my simple mind, I'm thinking, well, it could be Staph aureus or it could be Streptococcus pyogenes. Can you think of a real simple benchtop test that would let you determine if it is a member of the genus Staphylococcus or is it a member of the genus Streptococcus? Good job, you guys. All right. And what's the substrate? What's the reagent we use? Yeah, 3% hydrogen peroxide. If it's a Staph aureus, you guys, what would you see when you mix a Staph aureus with a hydrogen peroxide? Bubbles, yeah, because remember, all members of the genus Staphylococcus are catalase positive. And if it was a Streptococcus pyogenes, folks, what would you see? Nothing, right? Because all members of the genus Streptococcus, all members of the genus Lactococcus are all catalase negative. Awesome. So isn't that cool? Just like in a minute, you could determine. Anyway, I get excited about it. And then, folks, another one that I think it's really important that we know about is another gram-positive bacterial pathogen, gram-positive cocci, and a member of the genus Streptococcus. And these guys can colonize the vaginal mucosa of women, and we get really worried if pregnant women are colonized with this pathogen. And do you remember who that pathogen was? Group B strep, right, you guys. So I would presume that a physician would always, during pregnancy, take a vaginal swab and send it to the lab. If the woman was colonized with group B strep, you guys, what would be the appearance on blood auger? Beta hemolytic, right. So we want to remember that group B strep are beta hemolytic, Strep pyogenes, group A strep are beta hemolytic, and Staphylococcus aureus are beta hemolytic. There's others that are beta hemolytic, but just for our lab exam, we're just focusing on those three. And then, folks, what if you plate your microbe to blood and you incubate, and there's no hemolysis, no change? What do we call that? Gamma hemolysis, yeah. And most microbes are gamma hemolytic. Okay, good. So, you guys, so in summary, then, blood auger is enrichment and it's differential. Okay, good. And then for, this is great. Let's follow up, you guys, with a Staph aureus. Okay, so let's say that you have an infected surgical site. It's pussy, yeah, and we always worry about Staph aureus infections. So let's say you take a sample of pus and plate it to, what medium could I use that would select for the growth of members of the genus Staphylococcus? Good, MSA. So mannitol salt agar, folks. And remember, it's selective for salt-tolerant microbes, and members of the genus Staphylococcus have evolved to live on our skin, and our skin's salty. So it makes sense that mannitol salt agar will select for the growth of salt-tolerant microbes like Staph aureus. So you guys, the S is for sodium chloride, and I'd like you to know that if you're making mannitol salt agar, you add sodium chloride to 7.5% weight per volume. And so that means 7.5 grams per 100 mils. So you guys, if you're making 100 mils of MSA, how much sodium chloride would you add? 7.5 grams. But if you wanted to make a liter, how much sodium chloride would you add? 75 grams. Yeah, good, you guys. So the highest salt will inhibit non-salt tolerant microbes. It will select for the growth of Staphylococcus. But then, folks, you'll remember that Staphylococcus aureus has a close cousin, Staphylococcus epidermidis. It's probably a commensal on all of our skin. And Staphylococcus epidermis is more of an opportunist. Usually it's only going to cause infection in maybe somebody whose defenses are lowered. It's nowhere near as aggressive as Staph aureus, and usually it's sensitive to more antibiotics. So it would be awesome, you guys, if the mannitol salt agar would let us differentiate between the highly virulent Staph aureus and the less virulent Staph epidermidis. So do you remember, folks, is MSA also differential? It is, and it's differential based on mannitol fermentation. Mannitol is a sugar alcohol. If it's fermented, we'll get acids, just like we get acids if sugars are fermented. So if your microbe can ferment mannitol, the pH decreases, and the pH indicator, which is phenol red, will turn yellow. So mannitol salt agar then can let us distinguish between the mannitol fermenting Staph aureus from its mannitol non-fermenting cousin Staphylococcus epidermidis. So again, folks, since the Staph epi can't ferment the mannitol, it has to tear apart amino acids, releasing the amino group is ammonia, which we know is a weak base. So we're going to get an alkaline reaction. And what color is phenol red at alkaline pH? Red. Good. Awesome, you guys. So that's our MSA. And then the last one, you guys, and this to me is like the most complicated, is the McConkey's medium. And folks, do you remember this is selective for which group of microbes? Remember we used it to screen for E. coli contaminated food or water? Yeah, gram-negative Enterobacteriaceae. So we're going to select for the growth of the gram-negative Enterobacteriaceae. Oh, and you guys, I made a little sheet here just with highlights. I know this is so low-tech. I need a chalkboard. Okay, so the McConkey's auger, folks, it's selective for the gram-negative Enterobacteriaceae and the inhibitors, because often we ask you what are the inhibitors. The inhibitors are bile salts, so that will inhibit microbes that haven't evolved to live in the intestinal tract. And it also includes crystal violet, and crystal violet inhibits gram-positives. So the bile salts would inhibit gram-negatives that haven't evolved in the intestinal tract. So that's going to inhibit non-enterics. The crystal violet, the bile salts and crystal violet will also help inhibit gram-positives. So it's differential, folks. Do you remember it's differential based on which sugar? Lactose. Okay, so lactose is the only sugar present. So if your microbe can ferment lactose, the pH will decrease. And the pH indicator in this, which I always forget, the pH indicator is called neutral red. And at acidic pH, the neutral red is pink. So if your microbe can ferment lactose on McConkey's, it'll appear as pink colonies. So this would be E. coli. On this McConkey's plate, you guys, this would be E. coli or lactose fermenting enteric. And if the microbes can't ferment lactose, they attack the amino acids, make an alkaline reaction. And at alkaline pH, neutral is basically colorless. So McConkey's lac positives are pink, lac negatives are colorless or white. So again, you guys, let's say we were testing well water. Let's say this was well A and that's well B, microbes you've isolated. Which one are you more worried has fecal contamination? A, right? Because remember, E. coli, our fecal indicator, is lactose positive. Good. I think that's it, folks. Just going through that. So we did TSA, all-purpose, SAB, selective for fungi, blood auger, enrichment and differential based on hemolysis, mannitol salt, selective for salt tolerant, differential based on mannitol fermentation. McConkey's is selective for gram-negative Enterobacteriaceae, and differential based on lactose fermentation. Okay, guys, we'll shut this one down. Do you have any questions we could add to this, you guys?
Would we need to know, like, for like the E. coli and the Enterobacter, which is gram-positive or gram-negative? Or like,
So,
how would we do that?
Okay, so we do want to remember that huge family Enterobacteriaceae, they're all gram-negatives. They're all gram-negative bacilli, but there are two groups, lactose fermenting and lactose non-fermenting. The reason we are discussing IMVIC is E. coli, the fecal indicator, and its cousin Enterobacter aurogenes, which doesn't necessarily indicate fecal contamination. They're both lactose fermenters. So it's like, how do we distinguish them? We run the IMVIC tests. So E. coli has positive, positive, negative, negative. Enterobacter is negative, negative, positive, positive. Yeah, it's one use in like public health microbiology. If you're trying to determine if food or water is contaminated with feces, we use the presence of E. coli in high numbers. Yeah, and we were describing how Enterobacter can live in the intestine, it can be in feces, but it could also just be growing out in dead organic matter. So if you just have Enterobacter contaminating, say, water, it might just be runoff from, the forest or the field or something, it doesn't necessarily mean fecal contamination. It's when we see E. coli in high numbers we get really worried. Yeah. Okay, so we'll shut this one down, and I'll just ask you guys if